I would now like to have the privilege of introducing Dr. Aucoin. Monique is a licensed, board-certified naturopathic doctor. She has an honors Bachelor of Medical Science from the University of Western Ontario. She's a Doctor of Naturopathic Medicine from the Canadian College of Naturopathic Medicine. She's a member of both the Canadian and the Ontario Association of Naturopathic Doctors. She has taken additional training in mental health, mindfulness, mind-body medicine, and cognitive behavioral therapy. She also has a very special interest in mood disorders and anxiety. Please join me in welcoming Monique Aucoin.
Great, thank you very much for that introduction. I'm delighted to be here today to speak to you about mood disorders and how we can use nutrition therapeutically in their treatment. So starting off, what are mood disorders? This is a category that includes a number of conditions. Major depressive disorder is a chronic relapsing disease, meaning that it comes and goes for a long period of time in a person's life. It's characterized by low mood, loss of interest or pleasure, as well as changes in concentration, energy, sleep, and appetite. We see major depressive episodes are characteristic of having these types of symptoms for a period of 2 or more weeks most of the time. Dysthymia, on the other hand, involves persistent lower-grade depression. Bipolar mood disorder involves episodes of major depression alternating with episodes of elevated mood or manic episodes. And seasonal affective disorder involves depression during certain seasons of the year. When we talk about the incidence, which was already mentioned, 8% of the population will experience major depressive disorder at some point in their lifetime. And it affects all ages, cultures, education, and income levels, and often begins in childhood, adolescence, or early adulthood. There's a significant impact of mood disorders. In Canada, mental illness is the leading cause of disability. The economic cost in 2011 was $22 billion. And of course, there's a tremendous personal impact on patients, their family, coworkers, and friends as well. So what causes depression? It's kind of a tough question. Our understanding of mental illness lags a little bit behind our understanding of most physical illnesses, partly because the brain is extremely complex and really difficult to study. But our most current understanding suggests that neurotransmitters, these messenger molecules in the brain, that imbalances in these neurotransmitters creates mood disorders. So these neurotransmitters, they impact moods, thoughts, behaviors, motivation, and reward. And 2 examples of neurotransmitters that are involved in depression are serotonin and dopamine. Those are going to come up a little bit in our presentation today. So the bottom line, changes in neurotransmitters result in changes in mood. So how are mood disorders conventionally treated? Oftentimes, patients are prescribed 1 or more antidepressant medications, and these are medications that are designed to increase specific levels of neurotransmitters within the brain. As well as psychotherapy can be used to address and change negative thought patterns or belief systems that are characteristic of depression. And we want to ask, how effective are these treatments? It's a really important question. And there was a study called the STAR-D study that sought to kind of make some sense of that issue of how effective are these treatment strategies. The way the study worked is they gathered a bunch of patients that had depression and gave them all an antidepressant medication. Then they saw who responded, who didn't. And everybody who didn't respond, they added another medication or changed to another medication. And they kept doing this to try and see if they could help everyone resolve their depression. So here are the results. After the first antidepressant was given to all the patients, 33% of the individuals achieved remission. So 1/3 of the patients were no longer depressed. After trying or adding 4 medications or psychotherapy, 70% achieved remission. So 70% were no longer suffering from depression, but that still means that 30% were still depressed. So the bottom line of this study is that antidepressants can help some people achieve remission, can help resolve depression, but they don't work for everyone, and there's still room for improvement. So a little bit about my perspective. As a naturopathic doctor, I want to ask, okay, yes, maybe neurotransmitters are out of balance and causing your depression, but why are those neurotransmitters out of balance? Let's ask why that came to be. So if you ask most people this question, they'll often cite genetics as a big factor for why those neurotransmitters are out of balance. And that certainly can be the case. We know that there's a strong familial tendency that if patients have a parent that suffers from depression, they are at an elevated risk. But we know that that's not the whole story. Not everybody with a family history of depression suffers from depression. So we want to try and figure out what else is going on here. I want to ask, what factors might be contributing to this person's imbalance of neurotransmitters? What are they getting too much of, or maybe not tolerating very well? Or what are they not getting enough of? What else is happening in the body? So we know that in depression, everything that happens from the neck up is obviously really important. But the newer research that's coming out is suggesting that the neck down is also really important too, that there are systemic factors looking at lots of different processes that are happening in the body as being potentially involved in our mood regulation. We're going to talk about some of those today. How can their body rebalance? I love this one. So unlike your car or a robot, your body can heal. If you were to break your arm, you don't walk around with a broken arm for the rest of your life. It heals. Those bone cells are created and repaired. And that applies to your entire health. Your entire body has mechanisms for restoring balance, for repairing, for coming back into homeostasis. And we just need to create those right conditions for that to occur. We want to make sure that we're taking away things that are interfering with your body's ability to rebalance and giving it what it needs in order to rebalance. And lastly, how can we improve health overall rather than just focusing on decreasing symptoms? So throughout our time here today, I'm going to use a case from my clinical practice to just illustrate my approach a little bit. AB is a 68-year-old gentleman who came to see me because of depression and, quote, wanting to be healthier. He also had high blood pressure and high cholesterol, and he was taking medication for both blood pressure and cholesterol, as well as Cipralex and antidepressant. He was slightly overweight. So let's begin with nutrition. This is why we're here today, a really important piece. What do we know about the relationship between food and mood? Well, there are a number of studies that show a relationship between a healthier diet and better emotional health, as well as a relationship between poorer diet and more emotional distress. Of course, it's really important to ask what came first, because we want to distinguish whether the poor diet caused the poor mental health or the poor mental health caused the poor diet. So the second study that I highlighted there tries to address that question. They rounded up a group of patients, or a group of participants, and assessed their diet. Then they followed them for 16 years and saw who ended up getting depression, who didn't. And they found that patients who had a better diet at the beginning, when they measured it, were 34% less likely to go on to develop depression. So it seems like there could be a relationship here. So coming back to AB, when I asked him about what he was eating, this is what he gave me for his 24-hour sample diet. For breakfast, he was having cornflakes with milk or an English muffin with jam. For lunch, he was having cold cuts on a bun with potato salad. For dinner, he had fish and chips or pizza. For snack, he was having a piece of fruit, 2 to 3 glasses of water a day, and 1 to 2 glasses of juice. And this is pretty typical of patients that I see coming into my office. So let's start at the basics with nutrition, with the macronutrients. So everything that we eat is made up of some combination of carbohydrates, protein, and fat. Carbohydrates are found in things like grains, so wheat, rice, oats, in fruit, starchy vegetables like potato and corn, and of course sugar. Protein is found in higher quantities in meat, fish, eggs, legumes, nuts and seeds, and soy products. And fats are found in oils, butters, avocado, and nuts and seeds. So we'll look at them individually and how they relate to the brain and mental health, starting off with carbohydrates. So the brain makes up 2% of our body's weight, but it uses about 25% of the body's energy. It's a really demanding organ in terms of energy supply. The thing about the brain, unlike many other organs in the body, is that it can only use sugar as its energy supply, and it can't store it. It needs a constant supply of sugar, and that comes in the form of blood sugar. When we see that this sugar level in the blood is low, we get symptoms of hypoglycemia, or low blood sugar. And the symptoms include many neurological or mood-related symptoms: depression, anxiety, irritability, mental confusion, changes in behavior, and headache. So we know that the brain is extremely sensitive to changes in blood sugar, that when this blood sugar is out of balance, the brain really responds. Now, when we looked at AB's diet, most of you might say, well, there was plenty of sugar there. And if you thought that, you're absolutely right. There was lots, actually. The problem is when we have a diet that's higher in glycemic index or high in simple sugars, like the red line in the graph here, we see that the blood sugar goes up really quickly, and then the body releases insulin, which is our hormone that deals with blood sugar, and then the blood sugar goes down really quickly as a result. And it can happen that dips even low. In contrast, when we consume carbohydrates that are lower glycemic index, so they take longer to be broken down into sugar in the body, we see that the blood sugar doesn't go up as high, but we don't get that same crash afterwards. So the blood sugar is maintained in a more balanced range. So what kind of carbohydrates fall into these two categories? The higher glycemic index carbohydrates would be from sugar, obviously, honey and syrup, but also things like white pasta, white bread, white rice, or cereals. Lower glycemic index carbohydrates would be things like whole grain breads, whole grain pasta, brown rice, quinoa, steel-cut oats, sweet potatoes, or carrots. So moving on to the brain and protein. So when we eat proteins, they're digested in the body and broken down into what are called amino acids. These are the building blocks of protein. And some of the amino acids have neurotransmitter activity in the body. So glycine, for example, is an amino acid. It's part of the breakdown of protein, and it acts in the brain as a neurotransmitter. Others are used in the synthesis of neurotransmitters. So we have the amino acid tyrosine is converted into dopamine, and the amino acid tryptophan is converted into serotonin. How does this play out clinically? Well, in one study, they increased or decreased the levels of tryptophan that people were eating in their diet, and as a result, they saw increases or decreases in the brain levels of serotonin. So the amount that we're eating in our diet does affect the amount of these neurotransmitters that are being produced in the brain. Another study involved tryptophan depletion. So they gave people a diet that had no tryptophan in it. And we saw that there was mood-lowering effects in susceptible patients and relapse of psychiatric illness in susceptible patients, people who had a previous history of psychiatric illness. So these amino acids do make a difference. Why might amino acids be low? Might be a question that you would ask. And a really common answer is low intake. A lot of patients, as in AB's case, a lot of psychiatric patients have a diet that's very high in carbohydrates and low in protein. And so we would have maybe a meal that's noodles and garlic bread or cereal and skim milk, where we're just not getting a lot of protein. Vegetarian or vegan diets certainly can be high in protein, but they can also be low if people aren't making a conscientious effort to include protein at every meal. As well, adequate digestive processes are really important. So in order to take that protein and convert it into those individual amino acids for the body to use, we rely on adequate stomach acid production. We need adequate digestive enzymes from the pancreas, and we need a balance of good bacteria in the colon. So lots of different functions involved in taking that protein and making those amino acids. Let's talk about the brain and fat. So 60% of the dry weight of the brain is fat. And we know that the types of fats that are present have an impact on function. So there are studies that show that low omega-3 fatty acids and low cholesterol are a significant risk factor for major depressive disorder and suicide. As well, we see that a study on bipolar patients found that they had lower levels of omega-3s in their blood, and that was even after they compared people who were eating the same amount. There was still a difference in how those omega-3s were being metabolized and stored in the blood. In addition to the structural role that the fats play within the brain, we see that the fats also have a significant impact on levels of inflammation in the body. And this is a really important subject that we're going to come back to in a little bit because it deserves a lot of attention. We see that when people eat omega-6 fats, we get the production of molecules that increase inflammation in the body. On the other hand, when we eat omega-3 fats, we get the production of molecules that decrease inflammation in the body. Now, as a result, the ratio or the balance of these two in the diet is particularly important. In our chart here, we can see that the historical human diet contained a ratio of about 1 to 2 of omega-3 to omega-6. So for every gram of omega-3 that people were eating, they were eating about 2 grams of omega-6. Unfortunately, the modern standard North American diet contains a ratio of about 1 to 15. So we're really significantly favoring that pro-inflammatory fat and really disrupting this ratio, balance of inflammation within the body, which, as I said, we're going to come back to because it's really important. But first, where do we get those fats from the diet? So our anti-inflammatory omega-3s come from a few sources, places like fish, flax, walnut, and hemp. Omega-9s also decrease inflammation. We get them from olive oil and avocados. And the omega-6 fats come from the plant oils, things like corn, sunflower, vegetable, cottonseed, and peanut oil. It's worth noting also some other types of fat that we can get in the diet. Saturated fat, which we know comes from meat, eggs, and dairy, also increases inflammation when it's in excess. Of course, we do need some saturated fat, but we want it to be in moderation. As well, trans fats, we know, really increase inflammation. And those are found in deep fried foods, processed foods, and commercial baked goods. Two other diet components that I'll highlight just really briefly. Fiber, really important for digestion, so those bacteria that we have in our digestive system, and improving blood sugar management. As we talked about the brain being really sensitive to blood sugar, the fiber helps to keep that blood sugar in a stable range. We get fiber from vegetables, fruit, and whole grains. And antioxidants also play a role in decreasing inflammation, and we get them from berries, cocoa, citrus, red wine, herbs and spices, and green tea. So how do we put this all together? Our goal is to create balanced meals. So we're combining low glycemic index or whole grain carbohydrates with a protein source, including fiber, and choosing healthy fats. We've got the avocado there and hopefully some flaxseed oil or olive oil on that salad. We don't know, but we'll assume that that's the case. So back to AB. His sample diet was, for breakfast, we got him to do a smoothie. That included whey protein as a protein source, fruit for a complex carbohydrate, and flaxseed for a healthy fat. For lunch, he had salad with chicken and mixed beans. For dinner, he was having fish with brown rice, cooked vegetables. And for snacks, things like walnuts, fruit, vegetables with hummus. We got him to increase his water intake and decrease juice. Oops. And at 1 month follow-up, AB reported that his energy had dramatically increased. He was walking in the evenings with his wife, something I hadn't even asked him to do, but probably a result of the increased energy. His mood had significantly improved, and he had lost 4 pounds. So we talked about the macronutrients. Those are the carbohydrates, fat, and protein. Those are the large components of the diet. Now we're going to talk about the micronutrients. So these are components of the diet that we require in small amounts. These are like the vitamins and minerals. A little bit of history on this topic. In the early 1900s, vitamin B3 or niacin deficiency was very common in the southern United States. And the symptoms of this deficiency included anxiety, depression, fatigue, and later on in its progression included delusions, hallucinations, dementia, and death. And there were often cases where this was misdiagnosed as schizophrenia. Later on, this relationship between the nutrient deficiency and these symptoms was identified, and people received proper treatment. But the lesson that we can take away from it is that nutritional deficiencies can cause psychological symptoms. So this is really important to look at these micronutrients in individuals' mental health. So how might micronutrients be involved in mental health? Well, one way is in neurotransmitter synthesis. So we're back to this pathway that we looked at a little bit earlier, where we have tryptophan, which is an amino acid that we get from including protein in our diet, and it's used in the production of serotonin, which is one of our neurotransmitters that's important for mood regulation. In this pathway, we see vitamin B6 is important for the conversion into serotonin. So if that's not adequately available in the body, that impairs production of serotonin. The other way that micronutrients can be involved is in gene expression, which is a really, really interesting area of study that's just sort of developing. It's called epigenetics. And has anybody heard of epigenetics? Oh, a few. Great. I like that. So epigenetics is the study of turning on and off genes in the body. It's this idea that your DNA is not our destiny, that even if we have a gene, it can be modified, and it may or may not be expressed. So that gene, even if you have it, might be active, but it might not. And part of this regulation of whether or not the genes are active or not relies on micronutrients within the body. So I'm going to give you a really cool example. Some of you might have heard of it, but I think it's really neat. It's the agouti mouse. So on the right-hand side, we have a healthy mouse, the brown one. And on the left, we have a mouse that has this agouti gene. And it's prone to being overweight, to cancer and diabetes, and it has this distinctive yellowish coat. Now, when we have a pregnant agouti mouse, she, first looking at the right side, goes on to produce babies that all have this agouti gene, and most of them end up expressing that gene. So they end up with the distinctive yellow coat. However, if we look at the left side, when we give this pregnant mouse a dietary supplement during pregnancy and while she's nursing her young, we see that most of the babies grow up to be healthy. 3 of the 4 babies end up, even though they have the agouti gene, they don't express it and they end up as healthy mice. So I think this is really cool. I don't know about you guys, but I think it's really empowering for patients. I have a lot of people that walk into my office and say, you know, I have this huge family history of this condition, so I'm probably going to get it. And I love being able to say that, no, what we do in our day-to-day lives, the choices that we make, our lifestyle, our diet, does have an impact and can have a significant impact as to whether or not people are affected by a condition, even if they're genetically prone to it. So I think this is pretty exciting stuff. One of the nutrients that was involved in that particular study is vitamin B12. So we know that vitamin B12 plays a role in serotonin synthesis, back to our neurotransmitter synthesis, and it plays a role in energy. So patients who have low levels of B12 are often really fatigued, which doesn't help when patients are experiencing depression. And vitamin B12 deficiency is actually pretty common. We see that the vegetarian and vegan diets are naturally low in B12. As well, many people don't absorb B12 very well. It relies on a really complex mechanism in the stomach that for a lot of people doesn't work very efficiently. So people are maybe taking in the B12, but it's not getting absorbed very well. As well, many medications can deplete the amount of B12 that people have in their body, things like metformin, birth control pills, and acid-blocking medications. The research on B12 is somewhat preliminary, but we see studies where patients with higher levels of B12 are more likely to respond to antidepressant medication. Folic acid is a related nutrient and also plays a role in the production of serotonin and dopamine. We see that patients with lower levels of folate have higher incidence of depression, poorer response to treatment, and higher rates of relapse, so their depression's more likely to come back. This study is a really exciting study. They took a group of patients that were taking 40 milligrams of fluoxetine, which is an antidepressant, for 28 weeks. And they looked at how much folic acid these people had in their blood. The patients who had low levels of folic acid had a 43% relapse rate during that time period. So almost half of them, their depression came back. Whereas the people with normal folic acid levels, there was a 3% relapse rate. So 43 versus 3%, that's a pretty substantial difference and pretty important to take note of. So the use of folic acid is primarily as an adjunctive therapy or an add-on. If patients are taking antidepressant medication, we see that it can improve the success rate in addition. Vitamin D is another nutrient that's gaining some attention in the field of integrative psychiatry. We see that there are many studies that show a relationship between lower levels of vitamin D in the blood and higher incidence and severity of depression. And there are preliminary studies that suggest that supplementation may be beneficial in patients with depression. As well, we know that seasonal affective disorder can benefit from vitamin D supplementation. Some other micronutrients that are also involved in neurotransmitter synthesis include magnesium, zinc, selenium, and vitamin C. So coming back to this topic of inflammation, this is a really exciting area of research when it comes to mental health. This was a quote from an article that was published in the Journal of the American Medical Association last summer, and it said the following: Psychiatric and neurodevelopmental disorders are being thought of more and more as systemic illnesses in which inflammation is involved. So looking at the whole body and looking at what's going on, including that level of chronic inflammation and how that might be related to mental health. So is it involved? In a study, we saw that patients with depression had higher levels of pro-inflammatory molecules in their blood and lower levels of anti-inflammatory molecules. In animal studies, when we inject animals with pro-inflammatory molecules, we induce a state of inflammation in those animals. We see a lack of interest, a decrease of activity, altered sleeping and eating behaviors. And in human studies, where we again inject people with those pro-inflammatory molecules, we see patients suffering from anxiety, irritability, hyperarousal, and hypomania symptoms. So how could this be involved? How could inflammation be influencing mood for individuals? Well, we see that there's a mechanism that we're aware of. Inflammatory molecules, when they're in the body, decrease dopamine production and increase the enzyme that breaks down serotonin. So there's a pretty clear rationale for how this might be taking place. If we see that we're having lower levels of dopamine and we're increasing the rate of getting rid of serotonin, overall there's less neurotransmitters available in the brain. And people might ask, why does this happen? Why would an animal or a human in a state of inflammation be affected by these mood changes? And there's some hypotheses that have been suggested. So one idea is that if an animal is injured or has an infection, it would be advantageous for its activity to be inhibited, so it can conserve its resources for fighting the infection or repairing the damage. As well, if there's a creature that's wounded or infected, they might be more susceptible to attack. So we see that this state of hypervigilance or anxiety could be advantageous. And what's the impact clinically? What do we know in clinical studies? Well, there have been studies that showed that higher levels of inflammation result in patients being less responsive to antidepressants and lithium. As well, a small study of patients with major depressive disorder who were considered non-responders, so patients who had taken an antidepressant and hadn't found relief, they were given aspirin, a really simple anti-inflammatory medication, and there was a substantial response and remission rate. So the question we want to ask here is it possible that the fire is the inflammation and the smoke is the depression? And if so, we want to put out the fire rather than managing the smoke, if that's the case. So where does inflammation come from? We talked a little bit already about diet and ways that inflammation can be present or can be contributed to by dietary factors. So the standard North American diet we know is low in omega-3s, high in omega-6s, high in saturated fat and trans fat, high in sugar, and low in fiber, which are all factors that contribute to inflammation. I think this is a really interesting picture here. I got it from an interesting series where they took pictures of families from around the world and what they eat over the course of an average week. And this was the American family. Pretty interesting. We also know that obesity, metabolic syndrome, chronic stress, physical inactivity, and insomnia are states of chronic inflammation. And when we talk about digestion, changes in the gut bacteria as well as food sensitivities can lead to increased levels of inflammation. I'll touch a little bit on the food sensitivities because this is an area that popular media is interested in somewhat these days. So food sensitivities are inappropriate immune reactions against food, and these are different than food allergies, where we could see life-threatening reactions to food. The reactions in food sensitivities are often a lot harder to pinpoint. More often they're vague or a little bit harder to identify. So things like fatigue, digestive discomfort, chronic skin conditions or congestion, mental fogginess or mood difficulties. And the most common foods that we see people reacting to are gluten, dairy, eggs, and sugar. There's two ways that we can assess for food sensitivities. The first is by sending a sample of blood off to the lab. There's a number of labs that offer this type of testing, and they can assess for the immune reaction products in the blood to see which foods you're reacting to, and send you a nice little report like the example that I've got up in the corner. The other way to assess for food sensitivities is using what's called a hypoallergenic diet, and that's where we eliminate the common allergens for a period of 2 or 3 weeks, see how people feel, and then systematically reintroduce foods and see which trigger a reaction. Again, the research in this area is really new and quite preliminary, but there was one study, a double-blind study, giving patients who had reported gluten sensitivity. We were exposing them to gluten. So the patients didn't know when they were getting it, and the researchers didn't know when they were getting it, but we found that the gluten exposure was related to worsening symptoms of depression. When we talk about inflammation, it's really important to talk about fish oil, which is our best source of those anti-inflammatory omega-3s. The two omega-3s that are found in fish oil are EPA and DHA. And fish oil can be a useful tool for managing depression on its own or as an add-on to antidepressant therapy. The form particularly matters. The research shows that formulas that are higher in EPA than DHA are more effective when it comes to treating mood disorders. So there's a ton of research in this area. I'm just going to highlight 3 studies here. The first was in a group of patients that were considered non-remitters. So they had depression, took an antidepressant medication, and hadn't found relief. And they were given adjunctive fish oil, so adding on fish oil in addition to that medication. We saw that 68% saw a 50% reduction in their symptoms compared to 25% in the placebo. So about 2/3 saw improvement compared to 1/4 in the placebo group or taking an inactive formula. There was one study that went head-to-head, fish oil and an antidepressant formula, and saw equal benefits. And there was one study in pregnant women, a group where we are cautious about using antidepressant medications, so they tried fish oil instead in this group and found a 62% response rate compared to 27% in the placebo group. So some really great results in this area of research. Probiotics, again, this is an area that's really just beginning to be explored in the realm of integrative psychiatry. But we know that we have good bacteria in our digestive system that play a lot of really important roles. They produce neurotransmitters. There's actually a whole bunch of serotonin and dopamine produced in the digestive system in addition to in the brain. And the bacteria balance affects our levels of inflammation as well. There are many factors that can decrease those good bacteria that we have in our digestive system, things like antibiotics, alcohol, medications, high sugar in the diet, or stress. And again, there are some preliminary studies showing that probiotics can improve anxiety and depression scores. So back to AB, our sample case. For him, based on his unique medical history, I prescribed fish oil and a vitamin D supplement. At 3-month follow-up, AB was reporting that he was no longer experiencing symptoms of depression. He was continuing to lose weight. He had seen his GP for an annual physical exam, and his blood pressure medication dose was decreased by 50%, probably as a result of his weight loss and some of these great diet and lifestyle changes he was making. And he had talked to his GP about interest in reducing or discontinuing his psychiatric medication because he was experiencing some significant side effects. So this is something that they had talked about, and his GP agreed that he would help him to wean off of the medication. So in order to help support him in that process, we started a herbal formula containing St. John's wort, passion flower, and valerian at a low dose to help minimize the effects of minimize withdrawal symptoms. So coming to some conversation about lifestyle. Exercise is one area that can have a significant impact on mood. A combination of studies on exercise showed a moderate clinical effect for depression, and some of the studies suggested that the social component may account for some of the benefits. So going to a Tai Chi class or walking with your neighbor may be more beneficial than solo exercise when it comes to the mental health benefit. One area about lifestyle that I talk to all my patients about because I think it's really important is thinking about how much time we spend in nature. Particularly for Torontonians, that can be something that's a challenge. There's tons of great research about the effects on our mental health, our physical health, like increasing our immune system and decreasing stress of spending time in a natural environment. There was one study that compared patients spending time in an urban environment to spending time in a forest. And we saw reductions in oxidative stress and inflammation, reductions in cortisol, which is our stress hormone, probably not a surprise, and improvements in negative mood scales. If this is something that's of interest to you, I've got the cover of a book there on the side, Your Brain on Nature. It's written by a medical doctor and a naturopathic doctor team, and it's a tremendous overview of the research in this area. a great read. With respect to lifestyle, we also want to look at stress management and how that relates to mood. So there's lots of different stress management tools, and different things work for different people. Things like yoga and Tai Chi can be helpful. Journaling, regular social contact, spending time with animals, we know is therapeutic, meditation, and doing things that you love. So finding hobbies that you're passionate about and making time for those, making that a priority in your life. And looks like we have enough time, so if you guys are up for it, we're going to do a really short mindfulness exercise. If you're comfortable, you can participate. If you're not comfortable, that's totally fine too. So if you'd like to, I'll get you to come to an upright position in your chair, just with both feet flat on the floor. Checking in that your posture is upright, that your shoulders are relaxed at your sides, and if you're comfortable, you can close your eyes. And starting off by taking a couple of nice deep breaths. Seeing if for the next few moments you can bring your full attention to the experience of breathing. Starting off by bringing the awareness to the abdomen and noticing the sensations in the belly as it expands on an inhalation, and as it relaxes on an exhalation. And if the mind wanders, which it will, that's okay. Just gently releasing that thought and bringing the attention back to the breath. You might try observing the breath in the chest, noticing the sensations as the ribs or the lungs expand and relax. Or you might observe the breath through the nose or the throat as it enters and exits the body. And again, if the mind wanders, that's fine. Just noticing where it's gone, releasing that thought gently, and guiding the awareness back to the breath. Taking one full deep inhalation and one full exhalation before bringing the awareness back to the room and opening the eyes when you're comfortable. Great, thank you all for participating. Can anybody say just really briefly anything that they noticed during that practice?
Feel much calmer.
Feeling calmer, okay, thanks for sharing. And certainly mindfulness, feeling calmer actually isn't even the goal, but it's a nice side effect that we notice. The goal in mindfulness is simply to pay attention to our present moments, however that might be. But certainly most people find that taking a pause results in feeling calmer. Thanks for sharing. Anyone else notice anything? Yeah.
I find that when you focus on your breath, you stop thinking about all the other things that you're thinking about, which leads to relaxation.
Nice. Certainly, there's a thought experiment. If I tell you, don't think about a white bear, oftentimes people do. When we tell ourselves not to think, we think. But having something else as the focus for our attention allows us to let go of those thoughts. So that's a great comment. Thanks for sharing. Anything else anyone noticed, just really briefly?
Could hear my heart beating.
Interesting. So increased awareness of body sensations. And that's a really powerful thing. Our body gives us really interesting clues reflecting back about our emotions. So tuning in to our body and how we're feeling is a really valuable process. Did anyone notice mind wandering? Anybody? Some? Okay, yeah, some honest people in the room. Great. And that's really common. That's a totally natural process. The mind wanders, that's what it does. But in meditation, we're becoming more aware of the patterns of the mind, noticing where the mind is going, which is a really valuable tool to be aware of our thought patterns. All right, so thanks for playing along, guys. Addressing thought patterns, so cognitive behavioral therapy, mindfulness-based cognitive therapy are great strategies for becoming more aware of our thoughts and feelings and how they relate. Two types of other complementary and alternative therapies that I'll just touch on really briefly when it comes to integrative approaches to psychiatry. One is herbal medicine. So St. John's wort is the herb that has the most research behind it. We know that it increases serotonin in the brain, so that neurotransmitter that we know is involved in mood. And it can be useful particularly in mild to moderate depression and when people are tapering off antidepressants, as in AB's case. There was a study, a meta-analysis, so they combined a whole bunch of different studies that compared St. John's wort to SSRIs, which is a class of antidepressant medications. And we saw similar clinical response and remission rates, and that patients taking the St. John's wort were less likely to stop as a result of adverse events. It's also highly tolerable. People do typically well on the St. John's wort. Studies show 10 to 38 times less adverse events compared to SSRIs, and no sedation, digestive discomfort, or sexual dysfunction symptoms. However, the caution in the top right corner is really important. There are a lot of interactions. So St. John's wort can interact with a lot of medications or natural health products, so it's really important to talk to a licensed healthcare practitioner, a naturopath, or a medical doctor before starting this herb to make sure that there isn't a risk of interactions. Acupuncture is a system of healthcare that's thousands of years old, involves inserting very thin needles at different points in the body to help restore balance in different organ systems. It can be used to target mood or antidepressant side effects. There was a study, 6 weeks of acupuncture compared to fluoxetine, an antidepressant, that saw similar improvement in mood, as well as similar changes at a cellular level, which is very encouraging. I was also involved in a study in my research work where we used acupuncture as a treatment for sexual dysfunction side effects of antidepressant medications, and we saw a benefit. So back to AB. At 6-month follow-up, he was continuing to take a low dose of the herbal formula, as well as continuing his omega-3s and vitamin D, and he was feeling well. Overall, he was feeling great in terms of his overall well-being. He was having more energy and more involvement with his hobbies and friends. So an important question is, how do we integrate nutritional therapies into your care? The first thing that I would recommend is connecting with a qualified professional in terms of getting really individualized prescription or recommendations for your particular concerns. As well, it's really important to tell your prescribing doctor if you are interested in adding integrative therapies or at least interested in it. This is really important for 2 reasons. One is that we want to make sure we're preventing interactions with medications and other natural health products. And the other reason is that we want to make sure that your dose of medication, if you are taking medication, continues to be appropriate. So in AB's case, we noticed that after he made a lot of diet and lifestyle changes, he required less medication, and that communication with his medical doctor was really important in making sure that that dose was decreased as appropriate. And then lastly, encouraging open communication between yourself and all of your healthcare professionals involved. We know that care works best when it's as a team and everybody is communicating. So in summary, we talked about some different ways that nutrition relates to mental health. First off, we talked about addressing the imbalances within the whole person. So looking for things like inflammation and deficiencies and addressing those concerns. We talked about how much diet matters. So looking at the balance between low glycemic index carbohydrates, protein, and healthy fats, as well as choosing good fats. And then finally, lifestyle can play an important part. So thinking about things like exercise, time in nature, and some different stress management techniques that work for you. So thank you so much for your attention. It's been my pleasure to speak with you this evening, and I'll be happy to take any questions that you have. Okay, so I've got a question here, which is a great question. Fish oil slide, isn't DHA better for the brain? So DHA is really important for brain development and growth. So DHA is a nutrient that's really important during pregnancy when the fetus's brain is being formed. However, we find that in the studies on adult population, EPA, formulas with higher levels of EPA are actually more effective for treating depression. So if you're pregnant, then we'd look at the relationship of EPA to DHA, but in a non-pregnant or male individual, the EPA is a more important nutrient for mental health. Great question. If someone other than my doctor prescribes a test for me, will my insurance pay for it? So that might be the food sensitivity testing, or there's lots of other tests that can look at levels of amino acids and other factors within the body. So the answer to that question is it depends. OHIP covers many of the tests that medical doctors prescribe, but unfortunately doesn't cover tests that naturopathic doctors and nutritionists would request. But insurance companies sometimes do. I find that in my practice, about half of patients, their insurance will cover testing, half won't. So really you have to call and ask them whether or not it's covered. So it depends is the answer. You talked about peanuts being high in omega-6 and walnuts being high in omega-3s. What about walnut butter as a common replacement for peanut butter? Would that help to increase my omega-3s? The answer is yes. Great question. There's lots of good nut butters out there that have use different nuts rather than peanuts, and certainly I think that's a great option. Okay, what do you think about dosing vitamin D at 10,000 IUs daily for depression? So that depends. Vitamin D is a nutrient that there is such a thing as too much. So something like B12, our body can get rid of it fairly easily, and there are no toxic effects of too high levels of B12. So we can pretty comfortably dose that nutrient without being too concerned about how high your levels get. Vitamin D, on the other hand, is different. There are symptoms and there are consequences of having too much vitamin D in the body. So really, if you want to be taking high doses of vitamin D, you need to get your vitamin D levels checked. Unfortunately, OHIP doesn't pay for vitamin D testing, so it is out of pocket, but if we're going to be dosing those higher amounts, it is important to know where those levels are at. What strain of bacteria in the probiotics do you think is most helpful for individuals suffering from anxiety and depression? It depends. I know that's not a great answer, but there are some different formulas that can be helpful. Overall, the strains that are on the market as probiotics in the capsule form compared to the yogurt form are going to be more effective and more effective for humans. But the particular strain depends on the person. Okay. I don't know the difference between nutritionists, dietitians, naturopaths, and homeopaths. How do I know which one is right for me? Okay, so naturopathic doctors and dietitians and more recently homeopaths are regulated health professions. So there's a college that regulates our work and we're accountable to. And there are different standards for being licensed in that area. Oh, great. So as a naturopathic doctor, it means doing an undergraduate degree and 4-year medical program and passing board and licensing exams, as well as continuing education requirements to remain licensed. In terms of what we do, it's different. Naturopathic doctors, we're trained in conventional assessment and diagnosis of disease, which is why we're licensed as primary healthcare providers, similar to medical doctors and nurse practitioners. But our approach to treatment is different. So we work with nutrition, supplements, herbal medicine, acupuncture, homeopathy. Nutritionists and dietitians obviously have a huge focus on nutrition interventions, and homeopaths have a huge focus on working with homeopathy. My sister's doctor never wishes to discuss anything other than medication. What do you recommend to help integrate other aspects of treatment? Again, that's an interesting question, and something that's difficult to navigate. I would say that, if that doctor is only interested in prescribing medication, that's up to them. But that doesn't mean that your sister can't utilize other therapies in her care. So certainly seeking out a professional that's qualified to help her with those integrative approaches, whether that's a naturopathic doctor, or a holistic nutritionist, or a herbalist, or an acupuncturist, finding somebody that can help her with that individualized treatment is really important. And then also communicating that back to the doctor to let them know that your sister is approaching her health from an integrative way, because, as I said, it's important that we want to minimize interactions and we want to make sure that everyone's on the same page, so that if changes in the treatment plan need to happen, that everyone's aware of that. And ways to sort of increase that collaboration, oftentimes that integrative clinician can write a letter or reach out to that medical doctor in order to foster that collaborative relationship. Okay, so what are your thoughts on supplementing GABA? So GABA is a neurotransmitter that has a calming effect within the brain. So I would say that, So it's certainly something that can be helpful. There are some preliminary studies that show that it's helpful. It's been recommended in high-dose capsules and low-dose chewables. However, I've read that it may not cross the blood-brain barrier. My understanding is that it does cross the blood-brain barrier and can have an impact and be a useful strategy. So what blood tests are available for food sensitivities and mood interaction? So there isn't any test that specifically addresses the relationship between food sensitivities and mood. The testing that's done looks at what's called antibodies, which are immune products that our body makes in response, well, it should make in response to things like bacteria and viruses and cancer cells and harmful stuff, and sometimes makes inappropriately against things that aren't harmful, so corn and potatoes. And the blood tests, what they're measuring is those antibodies, those immune products that are made in the blood against specific foods. There's no way to know if that specific immune reaction is contributing to a mood disorder, except for trying. So if we were to run a food sensitivity test and identify, say, eggs and corn came up for you, we'd get you to avoid eggs and corn and see if that makes a difference in terms of your mood symptoms. I wish the testing was further along, but that's sort of where it's at now. What does research say, or what is your opinion, on diets that are nearly free of carbs, whether high or low glycemic index? That's another interesting area that is gaining some traction. The paleo diet is what it's sometimes called, where people are eating the traditional human diet of a hunter-gatherer that we might have eaten 10,000 years ago. And that focuses on meat, nuts and seeds and vegetables, but doesn't involve grains that are a more recent addition to the human diet in terms of evolutionarily speaking. There's certainly a lot of anecdotal evidence that lower carb diets or no carb diets or the paleo diet can be helpful for mood disorders. There are clinicians that are recommending that as a strategy for patients. There isn't a ton of research on it yet, I would say, to my knowledge, but I think it's an area that people are finding helpful and probably an area that will have more research. Ooh, this is a cool question. I have a hard time remembering all of my supplements. Do you have any recommendations on creating a schedule or successfully working them into your daily life? Some tips that I would say, put them somewhere where you see them in your day so that you have, if you make a smoothie in the morning, put them in front of your blender so you have to see them before you get to that blender. Technology is fantastic. Well, it has some downsides, but it can be fantastic. I get a lot of my patients to set alarms on their phone, so it buzzes at 7 a.m. and says, take your supplements. So giving yourself some little reminder cues like that would be probably my best advice. Okay, what suggestions do you have if one has malabsorption in the gut? So that's a really common reason why people are going to be low in nutrients if they're taking them in, but they're not actually getting them into their body. So that process of absorption isn't happening, so the minerals are just going straight through. And here we want to look at repairing that digestive wall. We see in a lot of people who have inflammation in the digestive tract that absorption can be hindered. So looking at things like probiotics, looking at avoiding food allergens that can be contributing to chronic inflammation in that area. And there are other nutrients and herbs that can be really soothing to the digestive tract to decrease that inflammation and improve absorption. I've read that taking a B complex can improve symptoms of depression. What are your thoughts on this? So certainly there is a theoretical basis for why that might be the case, and that was because a lot of those B vitamins came up as being involved in neurotransmitter synthesis. So in a lot of those pathways, we had the amino acid as the starting point, and that amino acid was converted into the neurotransmitter. And in that pathway, there were B vitamins that were necessary. And if those B vitamins are lacking, that can impair the pathway of production for making those neurotransmitters. Can you mix supplements and take them all at once? I like these practical questions. So for the most part, yes. Things like herbs are better taken on their own, but most often nutrients taken together isn't a concern. There are a small number, things like calcium and iron don't do well together in terms of absorption, but for the most part, other nutrients do okay when you take them together, and that can help with remembering to get things in during the day. Okay, so vitamin E is described as the primary antioxidant in the Orthomolecular Health pamphlet. I understand that glutathione is the master antioxidant. What's the sort of conflict or misunderstanding here? So glutathione is a molecule in the body that's involved in decreasing oxidation. I think what this pamphlet is referring to is that of all of the nutrients that we can take in, vitamin E has a strong antioxidant effect. But glutathione is the molecule that the body makes in order to handle oxidative stress. I take liquid Norwegian fish oil with lemon. Is there any difference with the oil in capsules in terms of digestion and going off? So I would say that for the most part, I tell my patients when it comes to capsules versus liquid, it's largely preference in terms of what you're comfortable taking. The capsules are easy to remember and you can take them on the road. The liquid, you can hide it in smoothies or put it on a salad if it's lemon flavored, and people who don't like taking capsules, that's a nice advantage. Certainly in a liquid, there is a chance of spoiling. It doesn't last as long because it's exposed to air, which has an oxidizing effect. But my opinion is that it's largely preference. Can you recommend a college or school where you can study the best orthomolecular medicine? That's a good question. So certainly in the naturopathic medicine program, there's a significant orthomolecular component. I would say the courses offered by Orthomolecular Health would be a great way to increase your understanding. Beyond that, I don't know, but if whoever wrote this question wants to come talk to me, I can try and look into it for you, because off the top of my head, I'm not too sure. Do omega-3 fats in veggies convert into EPA DHA? Great question. So the answer is yes, but not very efficiently. So one of the main sources of omega-3 fats in veggies would be something like flax seeds, a vegetarian source, and they contain mostly alpha-lipoic acid, ALA. This ALA does get converted into EPA and DHA, but the rate is very low. Off the top of my head, I couldn't tell you the exact number, but I think it's between like 1% and 5% of the ALA gets converted into the EPA or DHA. So if people are not vegetarian, I do encourage them to use a fish-based source of EPA and DHA because it's a lot more potent and doesn't rely on the body using this sort of inefficient conversion to produce it. So why do medical doctors prescribe high doses of sleep meds to persons taking SSRIs? And what effect can high doses of sleep meds have if taken long term? Unfortunately, I'm not a medical doctor, so I can't tell you why medical doctors do that. I would guess it would be to manage, to make sure that people are sleeping well. We know that adequate sleep is extremely important for mood, and making sure that people are sleeping is significantly beneficial. But in terms of the rationale, I'm not sure. And certainly we see that sleep med use long term has some disadvantages, so finding natural ways to manage sleep is valuable. What do you do for low thyroid? So that's a little bit beyond the scope of the talk today, but certainly low thyroid can play a role in mood disorders. There is substantial evidence that when patients have low functioning of their thyroid, that they're more likely to suffer from depression, and managing the thyroid is important. So that can be through taking medications. Synthroid would be the medication that your doctor would prescribe that increases the level of thyroid hormone within the body. From a naturopathic perspective, there's some dietary strategies that we can work with, some supplements and some herbs that can be helpful for balancing thyroid function.